So we'll take questions for about the next 10 or 15 minutes or so, and if for folks who have more questions that we don't get to, I'm sure some of our panelists will be happy to stay a little bit later. So I think we have a question way over there. We're just going to wait if you can just get...
Yeah, this message is for Adam. I know Dr. Frank Gardner was the team psychologist for the Dixon Rangers in the early 90s. And he was doing neuropsychological testing with your team, is that correct?
I believe at the time, I'm not sure.
If you just use the mic.
The second part of the question, if he was doing it, how did the Rangers present that to the team, and how did you take the testing?
I don't believe I took a test while I was playing as a Ranger early in the 90s. I know Frank very well. I certainly know that in my draft year back in '86, had all sorts of different tests, both psychological and whatnot, taken. But again, this was in the early '90s, and I don't recall as a Ranger, because Frank was with us in the early '90s, taking a baseline test per se. So.
Yes, over there.
I have two questions. One is that at NYU's concussion clinic, I understand that different doctors of the different fields will work together, but which doctor will be in charge of getting together all the information and making the final decisions at NYU's concussion clinic? That's my question.
So I'm not quite sure I fully understand the question, but
yes.
we're committed to bringing folks who have received a recent concussion in quickly to see one of our physicians who we've designated as concussion specialist. That specialist, which could be a physiatrist, that's someone in rehab medicine, a neurologist, an orthopedist with a sports medicine specialty, will then assess whoever comes in, make the appropriate referrals, whether it's for additional treatment or more assessments or what have you, and that really becomes the prime person. Now, we also have a new nurse coordinator who really helps to bring everything together to make sure that things happen in a way that's efficient and it's quick, so that all the assessments or treatments that are needed are done in a very timely manner. But it's always going to be the physician who sees that particular patient who's going to be the person who is providing you the information that you need.
Okay, thank you. Can I ask one more question?
I don't know, can you? Of course you may.
Sorry. I have a son who suffered concussion over a year ago during ice hockey game, and then he had to take a year off, and he's going through rehabilitation with RUSC, vestibular rehabilitation. He's going through vision rehabilitation, vestibular rehabilitation, and also going through neurofeedback, and he is getting better. But initially, he took, before he had the hit, through the team, he did take baseline test.
Baseline cognitive testing,
yes.
You mean, right.
And then after the concussion, when he took the test, the test came back normal. And few months later, but his symptoms didn't go away. And 6 or 7 months later, when he took really thorough neuropsychological test, it did not show based on the neuropsychologist we saw. So it was very hard for us to, I'm just wondering, have you ever had the case like that? It does not show in the test, but there's a really severe, pretty serious symptoms with the patient. How do you deal with that?
Yeah, again, to emphasize, there are many different systems that are vulnerable in concussion, and some of them has been emphasized beautifully by Tyra, is that the vestibular system can be the primary focus of injury in any given athlete. For another athlete, it may be the cognitive testing that your son underwent and even more formal neuropsychological testing may be totally normal if the focus of injury is at the ear or the brainstem level here, rather than at the cortex level where immediate memory processing and cognitive processing occur. So it all depends on where the focus of injury is. Some athletes have multiple symptoms, have cognitive symptoms, thinking problems, as well as vestibular problems. But some may only be restricted to one of those domains.
Just on the neuropsych testing, also, why I said before, you have to look at the context of who was injured and what we're looking for. So I don't know what they look normal on neuropsych testing means. So some children might perform average on a lot of measures, but unless we really knew where they were before, they might have been a high average or superior learner beforehand. So that's why there does need to be really specific, individualized approach for people, from people who have experience with concussion and brain injury to see what is going on. Sometimes you can have normal testing and still be deficient. So if your child was functioning in the top 10 percentile and now is performing at the 50th percentile, they look okay and look average, but there might still be some effects on some of their evaluation. But as everyone is saying, it might not have affected them cognitively. He might feel different and have difficulty learning because of attention, because of fatigue, dizziness, balance, or any of that, which will affect learning but might not affect their testing in a one-on-one, hour-long evaluation session.
Yes, right behind you.
With regards to radiographic imaging, is there like a recommended timeline as to how long we should wait before we send an athlete for an MRI or a CT scan of the brain?
Want me to take that?
Yeah, go ahead.
Routine imaging is not needed in a typical concussion. However, if the symptoms worsen, that is something that you would definitely want to scan an individual. If they have significant amnesia, they have loss of consciousness, all of those other factors might make you inclined to image. Now, and that's something that we need to study further, is are there any advanced imaging techniques that predict who's at greatest risk to have persistent symptoms or to have chronic effects? I mean, that clearly is a separate issue related to research interest. But the typical concussion patient does not need a scan unless under those circumstances I just mentioned.
Thank you.
And I think there was one right behind you.
I'd like to just make one comment. One of the things that was omitted was the possibility of having delayed or early impact seizure. And in a patient who's not getting any better or who is changing variably, I think it's always important to have, and that's the advantage of a concussion center, to have a lot of eyes on and look at it from many different vantage points, because sometimes there's something else going on. And in childhood in general, children get 6 to 7 even viral illnesses per year. So sometimes it's true, unrelated, and you have to really take a look at the whole picture and the whole person. Also, with regard to imaging, some institutions have a protocol wherein they do contrast CAT scans if they are going to CAT scan somebody who had a head injury, because that would be a better way to pick up a cerebral contusion in the immediate aftermath. Whereas if you do delayed imaging, you might miss that. So not all concussions are created equal, in my opinion, and certainly you have to always be looking, particularly in a child, at what else might be going on, and not just presume that it's from a concussive injury that may have happened remotely.
I think those are valuable points by the great Dr. Form, a pediatric neurologist who's in the house tonight, and we welcome those comments. And I think that emphasizes the clinical evaluation by an expert is valuable to pick up these non-concussive injuries that may be masquerading as a concussion. And I think that there are these rare situations where a mild traumatic event could cause or bring out a previous problem that somebody's had that was unrecognized. That can happen as well. So I think the points are well taken.
With regard to concussion and other kinds of brain injuries, in addition to evaluation and realization of exactly what's going on, this is a question that I will understand if it can't be answered right away, but what kind of measures can be apply to prevent it from deteriorating worse or to prevent other aspects of it from getting worse?
So the question was, you wanted to see me check Adam Graves? Is that it on the, no. Now the question was about how do you prevent a concussion from getting worse? So the big things obviously are the return, whether we talked about return to learn, and also about keeping them out of play. So it's about, especially in the acute scenario, waiting for their symptoms to resolve, and then potentially after their most acute symptoms begin to resolve, then at that point considering getting them back to light exercise. But just like you would injure any area, it's very important to put the brain at rest, and we're learning more about that. So the big things are cognitive rest and exertional rest. So those are the big things to prevent any worsening of symptoms. And the key, obviously, not to return to play too early, where they risk, or any activity risking a second head injury both before that first one has resolved.
I got questions for you guys then. How long should cognitive rest go on? I mean, sometimes you're symptomatic for weeks, months. You know, when is enough cognitive rest enough? I'm asking you.
All right.
I want to
For
know.
me, I'm looking at a good 5 years for me for cognitive rest. You're talking about. You know, again, I think it really needs to be individualized because there is no formula, and perhaps you know one of the charges of our concussion center is research. So. Check back with us in a year. Maybe we'll have some data to speak to this. But you know, it really depends, and it depends what that rest is. To some of the points that were mentioned, we do need to think about what rest is. If someone's an athlete that's training every single day, it's going to practices every single day, and here we are telling them to rest, we do have to look at the context of what anxiety and depression, weight gain, different neurochemical changes that they're experiencing, and that may actually end up becoming more, have more deleterious effects than the concussion itself. So we really need to look at the context and really take the lead of the child, the system that they're in, or the adult, you know, erring on the side, well, using the gauge of, well, as soon as they're ready to go play Xbox for 2 hours and they're feeling okay, symptom-free, then they should be able to do schoolwork for 2 hours symptom-free. So you really need to look at the balance of both of
Right,
those.
and I would add, I think that what Dennis was talking about before, you know, some graduated return to some physical activity, I think is underrated. You know, I've had folks who say, well, you know, I'm not going to do any physical activity until all of my symptoms are better. And if you're one of these folks where it's going to take several months, boy, you know, being at rest for, you know, 5, 6, 7 months is not a good idea. So I think that part of what research needs to do, look at is increasing physical activity after a short period of time. And we don't know what that period of time is. You're right, we need to do the research. But very prolonged rest, I think, ultimately, in many cases, can be counterproductive. Other questions? I think this should, go ahead.
Sorry, yeah. This question's for Mr. Graves. I'm a certified personal trainer, and I'm very well aware that I'm at the bottom of the food chain. But part of the reason why I'm here is to eventually, you know, try to become the best athletic trainer I could be. So as a professional athlete, was there ever an athletic trainer that stood out to you, and what qualities did he have that made him stand out?
Well, just speaking to the whole personal fitness and certainly having a personal trainer, that is where that's what I was referencing as far as not just at the professional level, even at the amateur level, and certainly even in kids' sports, depending on where you are and what sport you're involved in. Kids have access to personal trainers, and I think on many different levels. I was very fortunate in the era that I grew up in. I guess that I just came just above my first year in Detroit. I'll give you an example. Came into camp, and all I had to do was get on a scale and cough a couple times, and they basically said, there's your equipment, go on the ice, and that was the extent of it. And then you fast forward it to the end of my career, and there's probably about a plethora of about 30 or 40 different testing exercises and whatnot that you had to do, from bench press to quickness to today's National Hockey League testing, and even in New York, we have lasers that can test how quickly and the arc in which players move from side to side to some of the weight equipment in that is done through hydraulics through the walls at the training center up in Terrytown. So it's really become dynamic, and certainly the field that you're going into has become that much more important certainly as the level goes up, because for me, a lot of performance is, I believe in, as far as performance is getting away a little bit from where we're at, is probability and preparation. And if you prepare properly, the probability of you having success is a lot greater. So therefore, I would say the field that you're going into is great. Stay positive, and certainly be very humble and understand that you're learning every day. And again, this is what this whole board is about, and it becomes abundantly clear. Brilliant people up here, and yet, still trying to learn from each other. And I think that's very important. You can learn from people in your field every day, and make sure that you're always reading and staying on top of your craft.
I think there was one right there who's been waiting very patiently.
Thank you for advocating for me, Dr. Flanagan. And thank you for the interesting presentations. If the panel sitting up here were commissioned to consider redesigning or instigating new rules for a sport, let's say hockey, for obvious reasons, what are some recommendations you would submit to mitigate the possibility of concussions? Number one, or number two, do you believe that it's the role of medicine or physicians to have a say in the way sports are played?
Dennis, why don't you go ahead?
So I think it's certainly the role of physicians and medicine in general to educate, right? I mean, that's really the key. Maybe not to make obviously we can't make the final decisions, but I think it's our role to do the research, do the proper studies, and then once we potentially have the right answers, or the ones that we believe are the right answers, at least to try to educate, whether it is the parents, the athletes, the coaches, about recommendations that we have. And obviously, again, it's up to them to make those final recommendations. Just one word in terms of contact sports, certainly I think they're in a little bit of jeopardy right now. I mean, who knows where this is all going to go. But one of the things that you hear being tossed around a lot is, and this has already started in hockey, I guess Adam could talk to it much better than I can, is about contact sports at young age. And so a lot of people already talk about no contact sports before potentially even as high as the age of 14. And I think that's probably something that's going to be visited. Maybe not 14, but at least, it might be 10, it might be 12 years old, but that's certainly one thing. And while we're learning more and we're seeing more and more consequences of concussion, I think that's certainly one place to start.
Well, I would agree certainly that the physicians need to play a role in helping to determine safer rules, do that through research. Clearly, we can't abdicate that role. I think that we went a little bit over, so I want to thank everybody for coming. For those who have additional questions, I'm sure many of the panel members will be staying a little bit longer. Well, maybe I will be staying a little bit longer. I don't want to promise their time, but thank you very much for coming. Safe ride home.